When Governor Charlie Baker announced the state was expanding vaccine eligibility yesterday, he warned there wouldn't be enough appointments for all 1 million people 65 and older or with 2 comorbidities to register right away. But when it came to technical capabilities, Baker assured everyone the state was ready.
I think the website will be in good shape for this.
Well, as it turned out, he was wrong. The website crashed, as I'm sure you know, showing various error messages for hours and delaying new appointments from being added to at least some mass vaccination sites until afternoon. And when the governor joined us today on Boston Public Radio, he was frustrated as well.
My hair's on fire about the whole thing. I can't even begin to tell you how pissed off I am. People did a lot of work preparing for this, but clearly they didn't do enough. I'm going to work very hard to make sure it doesn't happen again.
There were also several reports of people getting disconnected from the state's vaccine call center this morning. All in all, the whole thing felt like shades of the rollout for the 75 and older vaccines. And as State Rep Bill Driscoll tweeted this morning, the list of questions for the vaccine rollout oversight hearing gets longer by the day. The representative is referring there, by the way, to a series of hearings state legislators announced yesterday to look into what's gone wrong in the state's rollout and what the plans are to fix it, with the first hearing set a week from today before some joint committee. Frankly, seems a little bit late to me, but nevertheless. Of course, Governor Baker has been working over the last several weeks to address some of the top complaints, including adding asthma to the state's list of qualifying comorbidities yesterday and laying out a new plan to reach people in the most vulnerable communities. And while case rates and deaths have gone down, vaccination rates have gone up, putting Massachusetts in 24th place for people who've gotten at least one dose of the vaccine per capita, up from 42nd last week. And those improvements have helped raise the state's grade quite literally. Last week, a Harvard professor gave the state an F for its rollout, citing high death rates and a, quote, stumbling effort to get shots in arms. Now the state is getting a C in that same analysis. Joined by the man behind those report cards, Graham Allison, former Assistant Secretary of Defense, founding dean of Harvard's Kennedy School of Government, and former director of the university's Belfer Center for Science and International Affairs, where he's now a professor. Graham Allison, it's very good to see you. Thanks so much for being here.
Pleasure to be with you.
So we obviously improved week to week. What did we do differently in the last week from what we did before?
Well, I have not really made a detailed study of of what we've been doing. I think the good news is that Governor Baker is taking more personal responsibility for the results. And our purpose in putting together this report card was to try to help us in a more intelligible fashion see how Massachusetts is doing relative to the 49 other states that are facing a quite similar problem. And it wasn't with any, it was very uncomfortable calling the facts, facts, but results speak for themselves. In Massachusetts, a number of deaths per capita is out of sight compared to many other states. Well, those are human beings. Many of them are friends and relatives or colleagues who are not with us anymore. And the piece that I think is the most painful has been the frustration that you could see in the clip you did about the fact that there are 300,000 doses on the shelf right now today, rather than people's arms. Does that make any sense? No, it doesn't make any sense. And so I think the notion of the governor and then his team taking personal responsibility for results and then wanting to be judged by the results is what we're seeing more of. And I would say, run, Charlie, run.
Graham Allison, if I can just put up that comparative chart again, looking at vaccinations per capita, you said we went from 42nd to 24th. The governor shared with us today his data. He says from the CDC that we are actually, in terms of vaccinations per capita, already up to 9th. Regardless of who's right, that's a dramatic improvement. But it seems to me you got to know what went wrong before you figure out how to improve, we have a governor who is a former healthcare executive. We're one of the wealthiest states in the country. We have just about the best hospital system in America, if not the world. What fell apart, Graham Allison? Do you know?
It's first dumbfounding, and the reason again why, this is not my normal topic. I'm working very hard on China, and a lot of colleagues who have joined the Biden administration. But the idea that a state that has great coverage with respect to healthcare, so we have 90+%, we're the top of the country, hospitals, top of the country, wealth per capita, top of the country, could be at the bottom of the ranking in most of these relevant performance indicators. Is just befuddling. So I've looked at a couple of states that have done better. You want to take a strange example? I'm actually talking tonight to the fellow Dr. Marsh, who runs the program in West Virginia. You think of West Virginia, you think, what? West Virginia has done almost twice as well as we have in getting doses from the shelf to the arm. Now, how can this be? And this guy...
Let me talk, if I may interrupt you. Yeah. Let me talk about West Virginia for a second. One of the things that West Virginia has, which I'm sure you know, is that it has a centralized pre-registration system where everybody in the state registers, and then the state reaches out to you when your turn is up, and they tell you where to go. As you probably know, every member of the Massachusetts congressional delegation, with the exception of Richie Neal, signed a letter to the governor saying, we need that here. It's clear to me that that would be a stress reducer for members of the public. Would it be a great improver? Would it be a great improver for Massachusetts?
Absolutely, because, there are 5 other criteria, including how frustrated people become trying to get through the labyrinth and maze to get an appointment. I've experienced that myself. My wife, probably spent 15 hours getting our first appointment. So in a normal world, a restaurant or a hospital was your provider, or in West Virginia, a central. This is not rocket science. So I think we should be looking at what happens in other states, adapting them to our particular circumstances. And the fact that we haven't been doing this, I think ultimately, in the West Virginia case, the governor picked a person whom he has confidence in and who's a known delivery person. And this fellow gets up every day, and every link in the chain that's not working, he goes and finds out what it is, what the problem, why is the obstacle.
By the way, I would say in fairness to the governor, not only has he improved in his administration on your report card, but according to CDC data that I looked at this morning, we've had a pretty significant improvement, particularly in this vaccination per capita. Things are moving in the right direction. I want to step back, if I can, and look at the future. Every report I've read, Graham Allison, suggests that both in the United States and in most individual states, we have suffered from a decade of neglect when it comes to the public health infrastructure. Do you believe we've learned a lesson from this to the point where we'll be ready for the next pandemic just as we were not ready for this one?
Again, I wish and hope and pray so. This is not the last pandemic we'll see, you can be sure. Mm-hmm. But that, of course, has been said each decade for the last 4 decades. So I think this one may have riveted our attention enough. And I think the Biden team has got the idea that we might take this as the occasion for preparing for the next one. And if we did, that would be to everybody's good fortune.
Let me tap into some of your primary expertise. If we were unable to control a virus, coronavirus, and its natural spread, we were unable to control the unnatural spread of another virus, namely the SolarWinds hack. How susceptible are we to a biological attack, not led by the virus itself, but led by a Putin, for example? That's what worries me most, frankly.
Absolutely.
Am I right to be worried?
You're, again, right in the bullseye. So any adversary of the U.S. who hasn't learned from this miserable performance of the country, I start with Washington and its failures. But anyone who hasn't learned from that this is an extremely vulnerable country in which all I have to do is produce a pathogen, which is not that hard to do given genetic engineering, and then just release it in a dozen cities in the U.S. and watch what happens. In a year, I mean, the report out today, which is just helps you remind, that we saw a 1-year reduction in the life expectancy of all Americans in the past year. You can't. That happens in Africa, in a poor developing country where people really are struggling. That's not America. That's not the America that we want. And I think that's why another reason that for states that start with so many advantages like ours, we should be models the way we want to be, or the way we think of ourselves as, in efficiently dealing with issues like this. Yeah. Well, let me start with a piece of good news if I can. I think, if I just offer one piece of good news. How in the world is there a vaccine available today that was developed, that was created in about 5 months, whereas the average vaccine took 10 years? The answer is some companies worked very hard, and the feds did a good job with that warp speed for financing it, in which things that happen usually in 10 years, because it's an emergency, happen in 1 year. Thank God. Well, I'd say there's a lesson for all of us there.
Well, the lesson I'll take from that is just like a broken clock is right twice a day, Donald Trump was right once in 4 years, and he funded those efforts. Good for him. Graham Allison, it's great to see you. Keep at it. Talk to you soon.
Pleasure. Thank you for having me.